Urinary system. It is formed of the two kidneys and the excretory passages. The two kidneys are concerned with elimination of waste products, regulation of water and electrolyte balance, and maintaining the reaction of blood and the concentration of body fluids. The excretory passages are concerned with the conduction of urine from the kidney to the outside of the body. They are the two ureters, the urinary bladder, and the urethra. Urinary excretory passages. These are the minor and major calyces, the renal pelvis, ureter, urinary bladder, and urethra. The wall of each of these passages is formed of three layers: mucosa, musculosa, and adventitia. Ureter. Mucosa of the ureter appears folded and consists of transitional epithelium resting on a connective tissue corium. Musculosa is formed of smooth muscle fibers arranged in two layers, inner longitudinal and outer circular. In the lower third of the ureter, a third layer of longitudinal muscle fibers appear in musculosa. Therefore, it is formed of three layers: inner longitudinal, middle circular, and outer longitudinal. Adventitia. It is made of loose fibroelastic tissue with blood vessels, lymphatics, and nerves. Urinary bladder. It has the same structure as the lower part of the ureter. Mucosa is thrown into numerous folds and consists of transitional epithelium resting on a connective tissue corium. Musculosa is well developed, called detrusor muscle, formed of smooth muscle fibers arranged in three layers: inner and outer longitudinal and middle circular. Adventitia. It is made of loose fibroelastic tissue with blood vessels, lymphatics, and nerves. Over the fundus of the bladder, the adventitia is replaced by serosa due to the presence of peritoneum over it. Comparison between ureter and vas deferens. Ureter is an excretory passage for urine, while vas deferens is an excretory passage for semen. Ureter is long, has thick wall, wide, and folded lumen, while vas deferens is short, has thin wall, narrow, and less folded lumen. Structure. Ureter is composed of mucosa, musculosa, and adventitia. Mucosa consists of transitional epithelium and a wide connective tissue corium. Musculosa is thin, formed of two layers in the upper part, inner longitudinal and outer circular, and is composed of three layers in the lower part, near the urinary bladder, inner and outer longitudinal and middle circular. Vas deferens, on the other hand, is composed of mucosa, musculosa, and adventitia. Mucosa consists of pseudostratified columnar epithelium with sterocelia and a narrow connective tissue corium. Musculosa is very thick and prominent, formed of three layers, inner and outer longitudinal and middle circular. then adventitia of loose connective tissue. Excretory passages. These are the minor and major calyces, the renal pelvis, ureter, urinary bladder, and urethra. The wall of each of these passages is formed of 3 layers: mucosa, musculosa, and adventitia. Urethra. Male urethra is long passage, about 18 to 20 centimeter, extending from the urinary bladder to the outside, carrying urine from the urinary bladder and semen during ejaculation. It is divided into prostatic urethra, about 3 to 4 centimeter long, arises from the neck of the bladder. It lies within the prostate and is V-shaped in cross-section. The ejaculatory ducts and prostatic ducts open in its wall. It is lined with transitional epithelium. Smooth muscle fibers are arranged around the wall, forming the internal sphincter. Membranous urethra is about 1.5 centimeter long. It extends from the apex of the prostate to the root of the penis. It is lined with pseudostratified columnar epithelium. It is surrounded by striated muscle fibers forming the external sphincter under voluntary control. Then benile or cavernous urethra is the longest part, about 15 centimeter long. It is lined with stratified columnar epithelium, which changes to stratified squamous at the opening, fossa navicularis. Female urethra, on the other hand, is a short passage, about 3 to 5 centimeter long, extending from the urinary bladder to the outside. The lining epithelium is transitional at the neck of the bladder, then pseudostratified columnar and stratified columnar in its middle part, and finally stratified squamous at the terminal part. Mucus secreting glands of Leiter are present in the corium. Musculosa of inner longitudinal and outer circular smooth muscle. There is external sphincter of striated muscles under voluntary control around the mid portion of the urethra.